Thank you very much for joining us today on the program Healthy Living. We do sincerely apologize for coming on behind schedule due to circumstances beyond our control. We're here now and ready to serve you. My name is Adesuwa Osa-Uwagia. Today on the program, we want to look at sexually transmitted diseases or infections as the case may be. Some persons do not know when they have it. Some know but cannot put a name to it. Others just don't know what to do. Even those that know what to do would not want to do anything because of stigmatization. But if you go to the right place, you would not be stigmatized. If you do the right thing, you will be happy with yourself. This world does not owe you health. You owe yourself health. If you're going to stay healthy, then you must do the right thing to stay healthy. If you're going to stay alive, then you must do those things that will make you stay alive. Joining me today is Dr. Jolly Nosa Iguma, the CMD Journals Medical Center here in Benin City. We're happy to have you, Doctor.
Thank you. Good afternoon. Thanks for having me.
Okay. We're looking at sexually transmitted infections. We want to look at causes, treatment, and of course, management, if it can be cured as well. So when we're talking about sexually transmitted diseases or infections, as the case may be, Dr. Jolly, what are we looking at?
Yes, when we say sexually transmitted diseases, actually communicable disease. And by definition, we say they are a group of transmittable infection whose principal modes of transmission is intimate sexual contact involving the moist mucous membrane of the penis, the vagina, the cervix, the rectum, the anus, the mouth, the pharynx, and the adjacent skin structure. To summarize this very long explanation, we will say that sexually transmitted diseases are caused by microbes and is usually transferred from an infected person to non-infected person during sexual intercourse. When we are talking about sexual transmitted diseases, it's more or less like talking about health education relating to the genitals, that is sexual health. That's exactly what we're discussing. And just like the way you said earlier, World Health Organization have made us to know that sexual transmitted diseases occur every now and then. To be frank, as I said, 240 million cases are reported yearly. 240 million cases are reported yearly.
Yearly?
Yes, with people with sexually transmitted diseases. Out of this, 170 million are caused by Chlamydia vaginalis, which is also a type of this sexually transmitted disease. 92 million is caused by the Chlamydia trachomatis. Then 62 million is caused by the gonorrhea, and 2 million syphilis. So you can see that it's actually a very large number. But in our own environment, in this black world, because of the stigma attached to searching for treatment, most persons, we have this STD. Clandestinely, they will just keep it to themselves and start spreading it without actually coming for treatment. Even if they go for treatment, it's self-medication, because they don't want people to actually know that they have this infection until you start having complications that can even be deleterious and harmful to the person that harbors this infection. So we will say that this STD we're talking about, as I said earlier on, they are communicable disease and they are caused by infection.
So what are the common names, sexually transmitted infections we have in our environment?
Yes.
Commonly transmitted one.
If we look at it, we can classify it to actually look at the very common one. We can classify it as the bacteria, the virus, the fungal, the parasitic. So if we are to look at the bacteria type of sexually transmitted disease that are very common in our environment, we'll talk about gonorrhea. World Health Organization also reported that any sexually active male or female between the age of 15 to 24 years, 1 out of every 4 will have contracted gonorrhea. STD, usually gonorrhea. So you can see that it's a very common thing. So gonorrhea is a type of bacteria. Then we have syphilis. Then we have chlamydia. Those names, of course, will be familiar to even the viewers at home. They know them. They know that those names exist, but they might not be able to identify that. Oh, this is gonorrhea.
So what are the manifestations? How does it present?
Yes, like the bacterial causes, which is the chlamydia, the gonorrhea, the syphilis, they will present as urethral discharge in male. A male that has gonorrhea, they will have difficulty in passing urine. They have this kind of burning sensation when they are trying to pass urine. So the incubation period is 1 to 7 days. That is to say that the period of exposure to the time it starts manifesting is usually shortest 1 day, longest 7 days. Maybe a male that had a sexual intercourse with a female like 3 days ago or a day ago, then thereafter is now having difficulty passing urine, that kind of burning sensation or pus, this kind of fluid, white discharge coming out from the urethra. Okay. So these are the symptoms of the gonorrhea. And the female, 80% are usually asymptomatic, just because of the anatomical structure of their genitalia. So female, they can have this gonorrhea without even knowing that they have it. 80% will not even manifest the symptom. They might just have it in form of vaginal discharge. And we shouldn't forget that most females that harbor or that contract STD, like the gonorrhea, they will hide under the umbrella of toilet infection. I have toilet infection. They will never agree that it is sexually transmitted infection, or they actually contracted it through sexual contact. So other than this gonorrhea, we also have chlamydia, which is also bacteria. So the chlamydia will also manifest as burning sensation during urination by male, and also vaginal discharge in female. But the symptom is mild as compared to that of the gonorrhea. And the incubation period is usually 2 weeks to 4 weeks.
That's quite long.
Yeah, it's quite long as compared to gonorrhea. Gonorrhea, we just, when you look back, when you have this kind of symptom of, like in male, the burning sensation, then maybe purulent discharge from the urethra while you are urinating, or white discharge. So when you look back and say, okay, this is what I did like a week ago or 3 days ago. So, of course, you should be able to say this is actually where you contracted it from. Like the syphilis I also mentioned, which is also a bacterial cause, it should not actually manifest as urethral discharge, but it will manifest as genital ulcer. What that means is that you will just see like something like a sore in the private part, either the male or the female. For the male, it's usually at the glans penis, and the ulcer is usually painless, very painless, and it's just solitary, just single one. Just see a kind of a sore, around the glans penis. This one is that is the syphilis. That is how it manifests in male and also in female. Other than that, we also have what we call the urethral discharge. The urethral ulceration. We have talked about the urethral discharge, which is caused by gonorrhea and the chlamydia. So the urethral ulceration, of course, we have mentioned syphilis as a type.
As a type.
Yes. For the urethral ulceration, there are quite a number of organisms that will be responsible for this. For example, we might have what we call the Syphilis. This is a viral cause, actually. Apart from that, we might also have what we call the lymphogranuloma venereum. It's a bacterial cause, or the granuloma inguinale. Then we have the donovanosis or the chancroid. These are
others big medical names. I don't want my viewer to run away.
Yes, what I'm saying is that there is a way we can actually identify it. So what the person will manifest with when they have this kind of infection I've just mentioned is that they will come down with ulcer on the genitalia.
That's the male.
The male, exactly.
What about in the female too?
Around the vulva, they just have this kind of lymph node enlargement. They have this kind of painful, joints around the genital. They have swelling around that place. Other than that, there's this kind of painful or beefy ulcer around the genitalia. In form of a sore, not actually due to trauma. Maybe it just came up gradually and it started, getting enlarged, like that. So it's a form of a sexual transmitted disease, in form of manifestation. Other than that, we also have what we call the genital itching. This one is very common in female. That is to say that because of the change in the environment of the female genital organ. They can just start having itching. The itching can be so severe to the extent it cause, peeling and
that's
bleeding.
What they call in local parlance.
Exactly. They will just be itching. And even the male too, they can also have itching in the urethra. They have where that urine comes out from. They just have itching there. This is also a form of a manifestation or a symptom of the STD. And quite a number of organisms are also responsible for this. Now, like a female, we present more of this genital itching. The itching could be as a result of candidiasis. Okay. Candidiasis is a very common cause of vaginal discharge in females.
And what causes candidiasis in females? What causes candidiasis?
Candidiasis actually is caused by a fungal infection, either the Candida glabrata, Candida krusei, Candida tropicalis, or the Candida albicans. For somebody to be exposed to this candidiasis, it means that the person will have been consuming broad spectrum antibiotics. Anything that is capable of increasing the pH of the vagina.
Now, what was the pH now?
Yes, the normal pH is 4.5.
Okay.
So when the pH is increased, you can see that the person will start having this kind of white vaginal discharge. So candidiasis actually is not a sexually transmitted disease, but it could cause this kind of
itching and discomfort.
Discomfort to females, to the women, exactly. But most of them, I just feel it becomes worrisome to them that I've contracted an STD. It's not actually STD. Maybe they have immunosuppression. That is, their immune system status has reduced, or maybe they are taking immunosuppressant drugs like prednisolone. Okay.
Now, I'm particularly concerned about the female because the presentation is not usually obvious. The presentation does not come. The woman does not even know that she has contracted STI, except, of course, when there is a contact with a man and the man comes down, the man begins to complain before the woman will know. Some women will still not want to go to the hospital because they will be like, what's my own? I'm not feeling anything, I'm not seeing anything, so that's this headache. Meanwhile, the woman has it, but just because it's difficult for the woman to present on time, she may not want to go to the hospital. So what are the complications of sexually transmitted diseases in women now?
When we actually started this program, you asked what are the commonest STIs in our environment. I mentioned gonorrhea, chlamydia, then syphilis. So gonorrhea and chlamydia, which is very common among the male and female. And for the female, it will manifest as vaginal discharge. And don't forget
offensive or not offensive, color or colorless?
Offensive vaginal discharge, usually yellowish discharge. Okay. And offensive, yes. And 80% actually are asymptomatic. You see, for the fact that some women, they just have this discharge naturally, they might just, assume it to be a normal discharge. But when it's still longer in the body, like a female, it might result in what we call the pelvic inflammatory disease, which is a complication. Because this infection is supposed to be a lower genital tract infection.
But it will now ride up.
It now moves up, affecting the womb, causing endometritis.
Because of lack of attention.
Because of lack of attention. Okay. It will move up, affect the cervix, call it cervicitis. The womb, endometritis, can also affect the fallopian tube, or we refer to as the sapingitis. And if the infection is now moving upward, you can see that the fallopian tube, the right and the left, that is actually the site where fertilization takes place in women before it moves down to the uterus, where the baby will now be developing. So when there's a long-standing infection like the gonorrhea or chlamydia, when it has affected the fallopian tube, there might be scarring. Scarring is just like, you have a very tiny thread that is hollow. But by the time you now tie the thread now, you can see that it's no more smooth, but you can feel some breach there. That is what we call the scarring or the fibrosis now. Okay. So in that case, if there is a fertilization there, it could affect the left or the right. It's just like the way we have the right eye and the left eye. So also the woman has the left and the right fallopian tube. So depending on the one that is affected by this long-standing infection, which is the pelvic inflammatory disease now. So when there is fertilization, when there's fertilization, the embryo will now find it difficult to migrate down to the womb because of the fibrosis that has been caused now to the fallopian tube. So there will not be stasis. It therefore means that the embryo will not be there until it bursts the fallopian tube. Okay. So in that case, I will not say the woman just developed ectopic pregnancy. So you can see that.
And that could be very dangerous.
Very dangerous, yes. It's actually a gynecological emergency. So you see that women with long-standing gonorrhea or chlamydia infection without attention at the earlier stage could result to PID, and PID will not result to fibrosis or ectopic pregnancy in women. Not only that, if the two fallopian tubes are damaged, it therefore means that the woman will be unable to get pregnant. So there will be pure infertility in this woman.
Sexually transmitted infection can cause infertility.
Can cause infertility in women. That is exactly what I just explained. And meanwhile, either primary or secondary, if there is a fibrosis initially and fertilization is still able to take place there, the woman will find it difficult. I mean, the embryo will find it difficult to move down to the uterus. You know, it's the womb that actually carries the pregnancy, but the fertilization does not take place in the womb. But because of the infection in the fallopian tube now, because of the scarring there, so the embryo will not continue to be there. So that is how the ectopic pregnancy. That is the etiology of the ectopic pregnancy. And during the management, it's usually severed. What I mean, it's cut off.
That is, it's
exactly.
Off.
It's cut off, exactly. So if it happens to both the left and the right, so the two fallopian tubes will be lost, exactly. So that woman automatically will now become barren. She will not be able to give birth anymore on her own, except maybe through other assisted conception. Yes. Other than that, there's also what we refer to as the disseminated gonorrhea infection. So it therefore means that the gonorrhea is supposed to be a lower genital tract infection, but when it's still longer in the body, it can, move, and as small as gonorrhea, it's very common to say gonorrhea. Somebody will just say gonorrhea, exactly as a normal thing. But I will tell you that it's possible for a woman to actually infect a baby with gonorrhea. It's not actually a vertical transmission. Not in utero. Not that when the woman is pregnant, that is when she will, infect the baby. But when the baby is now born, during that early stage of life, during the first 1 month, because this gonorrhea infection can also affect the eyes. So, for as much as maybe the woman bathes and her hand come in contact with the genitalia, she could, carry some microbes from there, which is the Neisseria gonorrhea, and maybe through the process of taking care of the baby. If the hands of the mother, touches the baby, so you can see that the baby might not suffer what we call the gonococcal ophthemia neonatorium, in form of a ulceration in the eyes. Other than that, even syphilis too. Women are usually screened for STD during antenatal when they are pregnant to rule out some infection that could be transmitted from the mother to the baby through vertical transmission. One of them is hepatitis, which is a viral infection, and also an STD. Though you can also contract hepatitis B, C, or D from blood transfusion and sterilized needle. But you can also contract this viral hepatitis through sexual intercourse. So every pregnant woman, we screen them for hepatitis. We also screen them for syphilis, which is a bacteria. And still looking at the complication, syphilis, we have the primary, we have the secondary, we have the tertiary stage. The primary syphilis is just the one you see the chancre. The one I said you just have an ulcer, either on the male genital or the female genital, the wall. When this primary stage is not well taken care of,
it will not grow.
It will not next level. Growing. After many years, it might result to secondary syphilis. In that case, the person will have this kind of mucopapillary. We might have what we call the tertiary syphilis. Tertiary syphilis, it takes like 15 to 20 years. So this person might have what we call the cardiovascular syphilis, which will affect the valves of the heart. Even syphilis
Okay,
that
because
can move
I was going
migrate
to
the
ask
brain.
that we've been hearing from several quarters that the STI can actually
Yes, exactly.
get somebody down from the brain.
Somebody can start having this kind of insanity, insane behavior, abnormal behavior. Just syphilis, tertiary stage of syphilis.
That a lot of persons see
Yes,
as ordinary.
as ordinary.
It's not
syphilis,
ordinary after all.
But we are looking at the complications now. So the syphilis could find its way into the central nervous system and result to what we call the tabes dorsalis or general paresis of the insane. The person will start having this kind of abnormal behavior and, a form of organic psychosis. Not only that, STD can also affect male. We can also have complications in male. Like I said something about chlamydia and gonorrhea. So the chlamydia and gonorrhea, of course, manifest as urethral discharge in male. And if it's not well taken care of, or maybe self-medication, just go and take antibiotics, you just swallow, and maybe the symptom is just suppressed, but not completely eradicated. We can also have complications in male, like the urethral blockage. So what that means is that the male will find it difficult to actually pass urine because of the urethral stricture, because the gonorrhea or the chlamydia has affected that channel where urine is supposed to come out from. Yeah. And when that happens, it means that the man will have what we call the urinary retention. He will not be able to pass urine, and we have to quickly do some surgical intervention for this to be possible. Other than that, the male could also have what we call the epididymochitis. What that means is that this infection will now affect the testis, and the testis is that small coconut-like structure you see in the scrotum. That small, for the males. So when the infection goes inside the scrotum, goes inside the testis, it will affect it, result to this epididymochitis, and that is where the sperm is being produced in male for fertilization.
A man can also be rendered infertile. Infertile,
just like you have explained in male, just because of this bacteria, chlamydia, gonorrhea, as the case may be. So when that happens, it therefore means that the man will not be able to produce motile sperm. This man could have what we call the oligospermia or azoospermia, just as a result of that infection. Not only that, they can also have what we call the Fitz-Hodgkin syndrome. What that means is that gonorrhea and chlamydia could, when it disseminates, they produce, substance that can affect the liver, even the appendix. So we call it periappendicitis or perihepatitis. There is Fitz-Hodgkin syndrome, though not too very common. And not only that, we also have complications that can affect the bigger joint of the body, what refers to as the sexually active reactive arthropathy or arthritis. Some persons, after years of poorly treated gonorrhea or chlamydia, they will start having this kind of joint weakness and joint pain because the microbes have affected the joint, the large joint of the body. So you can see that the complication is so diverse. And not only that, a syphilitic mother could also transmit the syphilis to the child in utero, unlike the gonorrhea. The baby has to be born with gonorrhea, but in syphilis, the mother will just, vertical transmission. And in that case, if the baby is born alive, the baby will be striving to survive. Very small baby, sick baby, syphilitic baby, with rashes, find it difficult to eat. And sometimes if it might even cause what we call the intrauterine fetal death, as in the syphilis will affect the baby to the extent that it will kill the baby in utero, just the syphilis. That is why I said earlier on that mothers that are coming from antenatal, we screen them for syphilis, we screen them for hepatitis, so that even at that time they are coming for booking for their pregnancy, we quickly intervene to ensure that this vertical transmission is,
But unfortunately, most women do not go for antenatal care on time. They want to wait. Oh, my friend waited until she was like 6 or 7 months, so let me also wait. What works for A may just not work for B. So your best bet is to go for antenatal as soon as possible. All right, doctor, let's look at the issue of management. Because if there was proper management and treatment, I'm not sure it will get to that point where the person will now come down with a lot of complications. Now, the issue is this. Somebody is down with, let's look at the female now. The female is down with gonorrhea, syphilis, or whatnot, and going to the hospital becomes a problem. If at all, that lady wants to like take treatment because of stigmatization. Oh, this nurses will see me tomorrow and laugh. Oh, that person will see me tomorrow and laugh. That person will see and laugh. They will want to go to one small chemist somewhere. Oh, I feel like this, I feel like this. I want some medicine. Those are the kind of people you meet in a pharmaceutical shop, and you see them counting the drugs there because they don't want to talk where other people are. They want to do it clandestine. So let's look at management for those persons so that it doesn't get to that point where they will now be running from pillar to post. Yes,
if we are to look at the management, enlightenment, just like the way we are doing, proper education, because the 240 million cases, according to WHO, of STD that are reported yearly is a very small figure. If you look at the sexual activity that is taking place in our environment, it's a very small figure, because it's those that actually present that we have to collect data from. So in an environment or in a locality where persons don't really come for treatment, you don't actually know. So the data there is just like a presumed data, the 240.
Do we really have data in Nigeria?
We don't really have data in Nigeria.
To say,
so
okay,
I believe proper education is very important, just like the way we are doing. Because when you combine illiteracy with poverty, with ignorance, the problem becomes very monumental. So there should be a proper enlightenment, just like we are activists using this medium to enlighten the people. And not only that, people should have to understand, because instead of even treating it, there's a need for us to look at preventing it. Yes. Let it not even occur. Let's target the large number. So people should have to understand the use of barrier method of contraceptive. So contraceptive has to do with things that you do to ensure that during sexual intercourse there is no intimate contact, because there must be an intimate contact for one to be able to contract the STD. So when there's a barrier method, maybe the common use of condom by the male or femidom by the female, or diaphragm as the case may be, you can see that to an extent the STD will be reduced. Yes. Not only that, quite a number of these STD are prevented by vaccination during the early childhood age, like the human papilloma virus. It's also a type of STD. The human papilloma virus. We have the benign form, we have the malignant form.
Let me cut you short a little bit. You will continue from where we stop. All right, guys, it's about time you start calling in to ask the doctor questions. If you're feeling anything, he has talked about so many things. If you have 1, 2, 3, or 4 symptoms of what Dr. Jolly have talked about, please give him a call. And the number to call is 05052 290573. The number will be on your screen shortly. So give the doctor a call and ask all the questions that you need to ask on STI. There is no shame in it, okay? Ask a question and be free so that you don't come down with complications that may kill you or just render you infertile. So, doctor, let's continue.
Yes, like the human papilloma virus I was talking about. This human papilloma virus affects both the male and the female. It can be transmitted from male to female or female to male. And there are different strains of the human papilloma virus. We have 6, we have 8, we have 16 and 18. So the benign from the 6-8 we cause what we call the wart. So the wart is like a form of, it will appear form of a genital lump. Some persons will just start having this kind of a growth. They call it growth. Vesicular growth around the genital, even sometimes in the anal region. For people that do anal sex.
We are not promoting that.
Yes. So very, fleshy growth, around the genitalia. That is the wart. It's a form of STD. Then the human papilloma virus can also cause the cancer of the cervix. For a very young lady, we can actually give vaccination at the age of 12 to 16 years, as the case may be, to prevent it. Even the hepatitis, which is also a virus, hepatitis B, C, and D, there's a vaccine for it. So we can actually prevent them through vaccination. So other than that...
How available are these vaccines?
They are really available. They are available.
Okay, let's quickly do this call now. Hello, caller, good afternoon. All right, we lost that call.
Yes, other than that, there's a need for one to abstain, until one gets to the right age.
Okay.
Because I did say earlier that according to World Health Organization, 1 out of every 4 for a sexually active.
Hello, I think we have a call now, doctor. Hello, good afternoon. I
wish to call from here.
Okay, please tell us your name.
Yeah, my name is Aaron.
Okay.
From Sapele.
From Sapele, okay.
Yeah. I want to ask doctor. I do normally feel this pain from my lower abdomen. This time, because there was a time I feel the same pain like this. They told me it was sexual transmitted disease. I'm a married man, and I must not be playing games for the past 10 years. But yet, why would I have such?
Why do you feel this pain? Is it when you want to urinate, or the pain is just there continuously?
I urinate normal.
Okay, you urinate normally, but you have pains in your lower abdomen.
You used to give me break. Sometimes you ride on break. I thought it was appendicitis. But they said nothing.
Have you gone for any test to check?
This program, no. Is it that do I have another sexual transmitted disease?
Okay, doctor, you can hear him.
Okay, I believe there's a need for you to see a doctor. You only told us about the low abdominal pain. They tell us about urethral discharge.
He urinates normally?
He urinates normally, but
he's a married man. He's not a Don Juan. He's not into women.
Yes. Okay, you have to, there are many things other than sexually transmitted infection. Even normal bladder infection, form of a urinary tract infection, can cause the low abdominal pain.
That's UTI?
Yes, UTI.
Is UTI sexually transmitted?
No, UTI is not sexually transmitted.
Is it something that can be picked up in the toilet? Because most times you hear girls say, I have UTI, it was picked from the toilet and all that.
Yes, because of the, bad...
poor hygiene or
poor
something.
hygiene. The normal cleaning is supposed to be forward, backward. But most persons, most ladies that are not well trained do backward, forward. They carry microbes from the stool.
So the collar now, what's your advice to the collar?
Yes, the collar have to see a doctor. You see your personal doctor, let them do an evaluation for you. Even an abdominal scan could actually tell us what is causing the low abdominal pain. Okay. We start from there. So we have to firstly know and understand what is causing the low abdominal pain. That will be the first evaluation for this patient.
Okay. All right, 052290573 is the number. Hello. Hello. Good afternoon. Please reduce the audio level on your television sets, please. Are we good?
I want to ask a question.
You can only ask your question if you have reduced the audio level on your TV.
I have this infection. I don't know if it's infection, but his body is not always, it's my first job, but when I'm with him, his body is weak. And it's very weak.
Do me a favor, Can you start all over again? Hello? 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 Okay, what you do for us is this. If you reduce the audio level, that's the volume on your television set, reduce it or move away from what your television set is. We'll be able to hear you and talk. Hello, good afternoon, caller. Hello? All right, doctor, let's look at urinary tract infection that people will say they pick from toilet, they pick from here, they pick from there. Is it possible to transfer it to another person via sex?
Not at all. The only possible one, like we talk about Staphylococcus. Staphylococcus.
Okay, doctor, let's pick this call. Hello, caller. Hello? Hello? The problem is this. Reduce your volume. Hello?
Hello?
Hello, good afternoon.
Good afternoon. My name is Helen.
Okay.
I'm feeling some pain down off my wrist. I don't know.
You have what? What do you have? The problem here is the audio level on your television set. If you reduce it, it makes hearing easy for us because I can barely make out what you're saying. Good afternoon, caller. All right, while we're waiting for the next, Dr. Jolly.
Yes, most urinary tract infections are caused by the Enterobacteriaceae. So these are small microbes, the class of the microorganism that will cause this kind of urinary tract infection is the Enterobacteriaceae. Very common type of them include the Staph aureus, the Staph epidermidis, the Staph saprophyticus.
Okay, hello, caller, doctor. Hello, good afternoon. Hello? All right, I guess we lost that call. When you're calling us, reduce the audio level on your television set. Come out the volume from your TV set so that we can talk. If the volume is there, we will not be able to hear you. It will be so difficult. Hello, caller, good afternoon.
Yeah, good afternoon.
What's your name, please?
Who called some minutes ago? I said I should ask the doctor because I'm a farmer. I don't know, since me and my wife were faithful to ourselves, why sometimes I do have this kind of thing. Whether is it caused by the poultry where I attend to, and if is there anything as a farmer that I could do to prevent?
I can barely hear you. Hold on. Can you just come over again and be deliberate? Just come over again. Let me be able to hear you properly.
Yeah, I said I'm a farmer, a poultry attender.
You're a farmer?
Yeah. I run poultry. So
okay.
I don't know if both myself and my partner are faithful to.
If what?
We are faithful to each other. So I don't know where this is coming from. Is it that it's coming from the poultry of the bed? Yeah, I do take care of. And if so, how will I prevent it not to happen? Because sometimes those sickness you call, you measure.
Okay, what is happening to you? I want to know. What is this situation?
I have to get pain in my lower abdomen.
Okay.
Like I said, sometimes ago, about some years ago, about 10 years ago, I expressed such thing. Yes, I was told that it was sexual transmitted.
Okay.
And we cured that off. But now, I feel the same pain again. That's
in your lower abdomen. When you urinate, do you have problem urinating?
No.
You don't have problems urinating, but you just have this pain in your lower abdomen. You want to know if it's as a result of the poultry you're keeping.
Well, there are zoonotic diseases one can actually contract from keeping animals, but there's no case of lower abdomen that be reported because of the fact that you are a poultry farmer. So diseases that are contracted from keeping birds are usually respiratory tract associated. So that you have low abdominal pain, my best advice is to see your doctor so that we have to know some of the association. That is, if there is purulent discharge.
I guess he said he has gone to the hospital before and they said it might just be sexually transmitted disease.
Yes.
How possible is that?
It's not actually what we can just diagnose from the history alone. There is a need to do some laboratory investigation. So for the fact that he has complained of low abdominal pain, there's a need to evaluate to actually know the cause of the low abdominal pain. A simple ultrasound scan, we screen for maybe urethra swab for MCS, for microbial cultural sensitivity.
Is it advisable for this caller to do self-med? Okay,
not
the
at
low
all.
Abdominal pain, let me just go and
Not
get
at all.
drugs.
Not at all. If it's just a pain, I believe the pain has been there for a long time.
So
that is why he's worried about it. So he has to see the doctor and let them, do some investigation for him to know the cause of the low abdominal pain and to know the association. Because of the fact that the caller was not edible enough, we couldn't actually ask him whether he feel feverish along with the low abdominal pain, whether he's strained while he's urinating, as the case may be. it could just be a kind of a benign prostatic hyperplasia, what we call the BPH, as a result of the prostate enlargement. So there's a need to know the association, things that are related to this low abdominal pain, so that we will now be able to know the cause and how to manage it proper.
All right, Kola, please do well to visit a reputable hospital, get a proper check, because it could just be something different. Hello, good afternoon, Kola. Hello? All right, once again, when you're calling in, reduce the audio level on your television set or move away completely from the room where you have your television set, and then do the call. Hello, good afternoon. So what's your name?
Good afternoon, Mrs. Adewale. I want to speak with the doctor.
Okay, Mrs. Adewale, go ahead.
Sir, since 5 years now, almost 6 years, I did the operation. So this thing always come out from my vagina, white discharge. So I went to the hospital when they scratched and brought on me antibiotics like Chlamydia.
Okay.
So I took that, it started like 3 months. Since about the 2 coming out, I took it and said, normally the family used to see the child like that. But for me, it's suddenly, I don't know what to do.
Okay, you don't reach 6 years where you born the pikin, Abi?
Hello?
You say it's up to 6 years since you had the child.
Yes.
Okay, the discharge, it smell or what?
It's coming out, not to depend. Even anytime what to do, it always come out with the it just fell out.
Anytime you want to do what? Okay, doctor.
Hello?
You say anytime you want to do what?
Anytime what to do, remember what to go and see.
Okay.
The child always follow the teacher. But it's not through the line, it's through the vagina.
Okay, we'll get you. All right, doctor.
Yes, like what she said, that after the last delivery she had, so she has been having this kind of
discharge, especially when she wants to stool,
yes.
comes out.
You see, I was talking about normal discharge in female and also discharge that are not sexually transmitted in female. So the only time, it was only the Candidiasis I did mention. Another very common one that is not sexually transmitted is the Bacterial Vaginosis. Very offensive, greenish yellowish discharge, common among the females. And it's actually followed a gynecological procedure, maybe after a childbirth, because of the frequent digital examination.
Okay. So how do you manage that?
Yes. We have to do a swab for MCS. Okay. It's not actually STI. So women after that childbirth, they will just come down with that kind of vaginal discharge.
Isn't there a way to stop it?
Yes, exactly. You have to do that test so that we will now know the particular organism that are responsible for it. Okay. They will now do a sensitivity, know a particular antibiotics that can destroy that organism that is responsible for it. Okay. So, bacterial vaginosis and the candidiasis I explained earlier are very common cause of vaginal discharge in female, but not sexually transmitted. Okay. But because of change in one's hygiene or change in one's environment. I was explaining the normal lactobacilli, the normal pH environment of the vagina. So anything that is capable of increasing the pH 4.5, normal vaginal pH of 4.5 to like 7 or 8, of course, the pH has been increased. That could, result to abnormal discharge in this female. So anything that is also capable of reducing it below 4.5, it will, also cause abnormal discharge in female.
All right, doctor, our time is fast spent, and we really need to go. Just before you make your very last advice to the people watching us on the program, you want to do a follow-up, and a lot of people have been trying to call in to see if they can reach the doctor. Well, to do a follow-up, please call this number 080-3472-1750. The number again is 080-3472-1750. And Dr. Jolly Guma just said that the best for you is to avoid it. Avoid contracting sexually transmitted diseases by using protection during sex, and that will save you a lot of money, a lot of time, and keep you healthy. Dr. Jolly, thank you so much for being part of the program today.
Thanks for having me.
All right, we'll see you again next week. Until then, play safe and be healthy. Bye-bye.